Hi, my name is Cheyenne. I'm a nursing student, and today I'm going to be conducting a neurological assessment. Can you give me your name and date of birth, please?
Ben Johnson, January 15th, 97.
Awesome. Thanks, Ben. Ben, do you have any allergies that I need to know of?
No.
Nothing to no medications, anything like that?
No.
Awesome. Okay, good. Another question is, are you experiencing any pain or anything today?
Nope.
All right, great. General assessment. Patient is an overall good hygiene, well-groomed male who appears to be stated age. He is awake and alert. He is sitting in an upright position, no obvious signs of respiratory distress or discomfort. His skin looks well perfused, no signs of cyanosis, pallor, or ecchymosis. When I look at him, his face, there's no obvious facial drooping. There's no obvious muscle deformity or lack of muscle on one side, indicating weakness. And he's dressed appropriately for the weather, and I have no obvious concerns at this point. All right, Ben, I'm going to go ahead and just start by asking you a lot of different questions. You can give me the best answer that you have. If you don't know an answer, that's okay. Just let me know, okay? The first thing I'm going to ask is, where are you at right now?
My home.
Okay. What year is it?
2020.
And who's our president?
Donald Trump.
Good job. So patient is awake and oriented times 4. He is oriented to self, to place, to time, and to situation. So the next thing is just going to be about some different histories, your history and family history, all right? Do you know of any family history of a neurological disorder or disease like MS?
No.
What about a history of hypertension or high blood pressure?
Nope.
And then what about diabetes?
No.
Okay. Have you personally ever had a spinal cord injury, a back injury, or a head injury that you had to go to the hospital for?
Nope.
Okay. Do you ever experience any numbness or tingling in your fingers, your toes?
No.
Good. What about any pain? Do you have like unexplained pain in your arms or legs ever?
No.
Okay. Would you tell me if you did?
Yes.
Okay, good. Other than that, do you work out often?
Yes.
How often would you say?
2 to 3 times a week.
Okay, and do you do a mix of cardio and strength training, or is it more one or the other?
Probably more strength training lately, but cardio probably once a week.
Okay, good. What about your diet? What is that like?
Depends on where I'm at. I'm usually just eating whatever I have.
Okay. Would you say it's a relatively good diet? Do you eat a lot of carbs, a lot of fats, or more like fruits, veggies, meats, different things like that? All of the above?
Yeah.
Okay. Yeah. Okay, that's fine. Drinking water. Do you drink a lot of water?
Mm-hmm.
Okay. Do you drink alcohol?
No.
Do you use drugs?
No.
What about any tobacco products?
No.
Okay, good job. Other than that, I'm going to ask, are you afraid to go home? Do you have anybody with you that takes abuse of you or anything like that?
No.
Okay. If you need to talk about anything like that at any point, please let me know and we'll stop, okay? So with that in mind, we're going to go ahead and get started on your assessment. This is going to involve things like having you test your function of your fingers, your toes, different things like that. I'll have you test your balance, and I'll also be touching your arms and legs with a few different objects, and one will be sharp, dull, different things. So let me know if anything hurts. It shouldn't, but you should be able to tell a difference, okay?
Okay.
If you have any questions, let me know. If you have any concerns, stop me and I'll stop, okay?
Okay.
So the first thing we're going to do is the sharp dull, and I'm going to have you just close your eyes. I'm going to start in your arms, and I'm going to show you what each is going to feel like, okay?
Okay.
This is our dull.
Okay.
And this is our sharp.
Okay.
Okay, so I'm going to have you identify each time you feel a movement, okay? Tell me if it's dull or sharp.
All right. Dull.
Okay.
Dull. Sharp.
Good. We move to the other arm now.
Okay. Sharp.
Okay.
Dull. Sharp. Dull.
Good. Now I'm going to have you just move your arms a little bit. I'm going to do the same thing in your legs, okay? Sharp, dull, same thing. Let me know, okay?
Alright. Dull. Sharp. Sharp.
Good job. I'm going to move to the other leg.
Sharp. Dull. Dull.
Good job. You can open your eyes. So no deficit there, full sensation to sharp and dull in upper and lower extremities. The next thing I'm going to have you do is I'm going to go ahead and have you place your hands out in front of me. I'm going to have you identify an object, okay?
Okay.
So go ahead and close your eyes. Good. What is that object?
A coin.
Good job. Next one, I'm going to have you identify this object.
A paperclip.
Well done. You can open your eyes. Patient was able to identify both objects in his hand, so stereognosis is good, no deficit there. The next test is called gratifesia, and I'm going to have you close your eyes, and I'm going to draw something on your hands, one number, one letter, and I just want you to identify what those are, okay?
Okay.
Like I said, if you don't know, that's okay. You can just let me know, okay?
Okay.
Eyes closed. Good. Go ahead and tell me what number this is.
7.
Good job. Next, we're going to do a letter, okay?
Uppercase B.
Yeah, good job. You can open your eyes. So, no deficit there. Patient was able to correctly identify the letter and the number there. The next thing we're going to have you do is test your kinesthetic sensation. So I'm going to do this both on your hands and your feet. I'm going to move your finger up or down with your eyes closed. And I want you to tell me if I'm moving it up or down. Sound good? Okay, go ahead, close your eyes. I'm going to have you move your hands here. I'm going to show you what up and down both feel like, okay?
Okay.
That's up. That's down.
Okay.
Feels good?
Mm-hmm.
All right.
Up.
Good job.
Down. Down. One more. Up.
Good job. Then move to the other hand.
Down. Down. Up. Up.
Good job. I'm going to go ahead and do your feet now. Thank you.
Cocks off.
All right, I'm going to do the same thing. Go ahead and close your eyes. This will be up.
Okay.
This will be down.
Okay.
All right, ready?
Mm-hmm. Up. Up. Down.
Good job.
Down. Up. Up. Down.
Good job. You can open your eyes. So full kinesthetic sensation intact in both upper and lower extremities. No deficit there. The next thing I'm going to have you do is we're going to go ahead and can I have you wiggle your fingers in front? Good. And can I have you squeeze them together? So both gross and fine motor movement intact in the upper extremities. Can I have you do the same thing with your toes? And then squeeze them together. Good job. Full gross and motor fine movements in the lower extremities as well. The next thing I'm going to have you do you feel like you're able to stand up? Okay. Good job. So what I'm going to have you do is we're going to test your balance here. What I'll have you do first is I'm going to have you close your eyes and go ahead and put your hands out in front of you and then flip your hands over. Good. You can go ahead and put them down and open your eyes. So there's no drift noted with cerebellar function. It's completely intact and the muscle strength is equal bilaterally. The next thing I'm going to have you do is go ahead and put your hands out to your side and close your eyes. And go ahead and touch your nose to your finger to your nose, please. Either one. Yep. Go ahead and do the other one. Now put them back out. Now do it quickly. Can you do them quickly? Good job. Open your eyes. Next thing I'm going to have you do is heel to toe walk, kind of just like a sobriety test here.
Okay.
Just one foot in front of the other, okay? Good job. You can go ahead and take a seat now. Good job. So balance is good. There was no deficit, there was no swing, no drift, anything like that. There's no concern, no deficit in any of those functions. Other than that, do you have any questions for me, Ben?
No.
All right, thank you. Everything looks good from my understanding. Okay.
All right.